Everyone, we'll go ahead and get started. I'll let our amazing library team come up in just a second and kick things off. But I just wanted to welcome everyone to another academic year here at Moran. For any fellows in the room, I wanted to tell you how grateful we are with your patience for the bumpy onboarding process and apologize for that. If anyone is still having any type of issues connecting to the EMR or accessing their Outlook or anything that they need to practice medicine, please let me know. You should all hopefully have access by now. But again, we are very sorry for all the issues in your first week here that is very atypical. So thank you for your patience. And then I just wanted to remind everyone listening and everyone in the room that it is, of course, medical student season. So as our amazing students come and rotate through your clinics, please let me know which ones amaze you more than the other ones, or who your favorites are. So we can keep track of that, because always, we have such a great group of people, but as Judith always reminded everyone, come September, you can't remember who was who, even the really, really, really amazing ones. So please send me your feedback if you get a second. And that's it. Thanks, everyone.
Good morning, everyone. We're excited to share with you some of the work we're doing in the library committee and with the Moran Core. As always, this is something that we have to just first and foremost recognize the Bloomberg Library. We have Bryan here who's actually representing them, and we'll hear from later, giving us some of the stats from the Moran Core. But this collaboration has been so beneficial to us, and they have really been phenomenal with throwing some resources into this. So thank you so much. And thanks to the library. And we also are, well, a little bit of jump to the library committee first year. We have a great library committee. So as you can see, Kathleen Digre has been the chair for 35 years. Anyway, the number doesn't matter. Maybe a century, we don't know. But Kathleen actually and still is as vibrant and young as ever, and despite doing this for a long time. But she has stepped down, and the search committee was consumed with finding a new chair, so they reluctantly put me in the position to take over. But if it's okay, if we could all just give a little applause to Kathleen Digre for her service in this role for so many years. Is that okay? I've kind of begged her to stay on, and she's agreed. She's really continuing to be just so supportive to just the education mission of the Moran overall. She's really such a gifted educator. We have a lot of wonderful people also who serve on this committee, who also serve on working with the Moran Core. So thanks to all of them. We typically have Christy Jarvis, also another representative from the library committee, present. We timed this grand rounds largely because we want all the new residents and fellows and anyone else who's turned over in the new year to be aware of the many resources the library committee makes available to us. It's actually pretty phenomenal, and I think much more extensive than I even realize every year. So with that, Christy is actually unable to present. So Kathleen is actually kind of spoken with Christy and is going to present what she normally would about the library. So thank you.
Okay, thanks. Yeah, Christy is on vacation this week, and so unfortunately isn't here. But this is a person we need to know because she's the librarian from the Spencer S. Eccles Library. She's sort of our ambassador. So the things I'm going to talk about a little bit about are, what does the library, Eccles Library, do for us? And everybody needs to know that they really supply a lot of our journals. While the Bloomberg Library purchases many of the journals, most of the journals that we use are purchased by Eccles Library. And they can get us access to articles that they don't carry. They also are available to do some literature searches. So if you've got a new project, you can contact the reference librarian and they can help you with that. They also can help you with databases. And there are lots of new databases that are out there, and And Christy knows about these, and they're on the Eccles Library front page. They also can help you figure out good, effective research and search strategies for, let's say you want to do a full systematic review, and they can help you with that. They will also find you evidence-based information about clinical queries, and all you have to do, and this is from Epic. So from within Epic, you can go to the in basket, and you just go to the new message in the in basket, and it'll say to the library, and you can say, this person has this rare disease. I need more information about it. And they will get back to you out with a little bit of a search. So it's a way for you to also use them in your clinical care of patients. And then they can help with projects and expert searches. They also can set up save searches, alerts for you on your computer. They can help you figure out how to manage some of your data. They can help you with citation verification and also metrics. If you need to know your H factor or whatever for promotion, they will help you do that as well. And then, of course, the big thing that they're going to be doing, I'm going to talk about that, is the NIH public access compliance, which is a whole new issue from July 1st. Now, I want to mention something to all of you. All of us write papers, book chapters, books, etc. When you do this, try to keep the copyright to any figures, tables, or anything that you really, really want to be able to reuse again without asking for permission. So always do that, because otherwise the publisher takes away your right. And then you have to either buy your right back again, or you have to at least ask for permission. Now, this is the Eccles Library home site. And so this is your access to electronic books, and the library committee has really gone to electronic books mostly. And so you can access books, a whole book, an ophthalmology book in the Eccles Library. And some of them are also on Bloomberg, but all of them are cataloged through Eccles. Also, all of our journals. Now, if you are at home and you want to get off-campus access, see that little button down below, off-campus access. You can push that, and that becomes a VPN, and then you can search as if you are actually at the hospital. So this is the site you want to go to access the journals, because when you go to PubMed on the Eccles site, it already helps you figure out the Find It. So here you see the arrow is pointing to the Find It button, and I'm going to go back. Oops. So you can go to the Find It button and push the Find It button. That will take you to this full text option. And then you click on that, and you'll actually get the article, and you can download the PDF from there. But let's say you do a search and the library doesn't have it. Well, at the bottom of the page, you can see this Get a Library interlibrary loan. And up, if you push that button, up pops that whole article, all the information. You don't have to retype it or anything. It'll pop up into this gray box, and all you have to do is submit, and it'll go right to you if you've signed in. So this is an amazing service, and this is no charge to you, all free via the Eccles Library. So very, very important to know about. Now, July 1st, this new NIH public access policy went into effect. We've always had NIH and all federally funded projects have to be available for public access. But starting July 1st, they've added a whole new layer of urgency that as soon as your article is actually accepted, it's going to go into an open access situation. Now, publishers have not caught up with this law yet. So the library is actually, Christy's going to be coming to the House staff faculty meeting in August to explain this because it's kind of complicated, but they're there to be our friends and help us. And if you've got something that's being published right away, you can contact Christy and she'll walk you through the steps of what you need to do to get this to an open access situation, because there's some key requirements to this. So stay tuned, but also come to August 20th House staff faculty meeting to learn about this. And in the meantime, if you need it, it's christy.jarvis@utah.edu, and she'll help you with that entire access issue. And then this is a very important thing that Eccles also does. The University of Utah has actually partnered with a few publishers. And these publishers do immediate open access. And in the past, you've had to pay to do that. Well, now the library has partnered with them and they have this connection contract with some publishers, not all, but some publishers, and they will actually you don't have to pay for it. It just is an open access immediately. And don't forget to retain your copyright for all your figures, special tables, any, pictures. We're very visual specialty, so really hold on to your own copyright.
Yes.
Pardon?
What's PMC?
It's in PubMed Central. PubMed Central. PMC is PubMed Central. And this is part of this open access business. All right. And anyway, I'll let Christy deal with all the small details of getting everything into open access, but be aware that that they have partnered with certain journals. And if you want the list of journals, Christy has them that are ophthalmology specific. And then I just wanted to briefly mention 2 AI tools, artificial intelligence tools. First is Open Evidence AI. How many of you have tried that already? It's Open Evidence. You just put in Open Evidence and up it pops. It is a partnership with New England Journal of Medicine, JAMA, and the Mayo Clinic. And you can say, what is a chalazion? And boom, up pops an open evidence like paragraph. It never goes into great detail, but it does give you some very nice references. The other thing that the university has a contract with Microsoft is Copilot, and it's another open evidence tool. Now, there are a lot of these open evidence things, or not open evidence, but there are a lot of AI tools out there right now. We did a CRAM session, Clinical Research and Methods, that we do once a month with the Center of Excellence in Women's Health and the CTSI. And once a month, and we did a whole set, an hour-long AI session. And all you have to do is put that into Google and up it'll pop. But you can listen to a whole lecture on this. And I think we should probably have a grand rounds on this ourselves because it's very interesting. But open evidence does use evidence from PubMed. Copilot also does as well. But there are a lot of rules and finer points that you need to know about when using these tools, because you don't want to give your own intellectual property away using these tools. So, but they're very helpful for a lot of things. Well, any questions about that? All right, I'm going to turn it back to Griffin here, our editor-in-chief of Moran Corps.
So, Moran Corps is another part of the library committee, and yeah, I really think this has been such a wonderful project to share some of the great work that is being done at the Moran internationally. What's amazing, and Bryan will show this, is that it's being used all over the world, and I think we're really in an interesting age of not the age of information, but the age of misinformation, and there's just so much out there, and putting out high quality evidence-based medical teaching is just so medical and surgical teaching is just so valuable. And the Moran is kind of developing a brand on it that is, I think, really important as well to kind of help people feel like there's some quality control in this. So the here's all the people who are on, and just a couple of points. Judith Warner wanted me to mention that for quality improvement, those videos are actually the projects from Research Day are up and posted on the Moran Corps website. Is that correct, Judith? And then the other thing that's actually missing here, and I don't know if Teresa Long is here, but Teresa is launching another new section on ophthalmic trauma, which will be fabulous. I think that's kind of it's pretty unique to have an ophthalmologic hospitalist. And so she's going to include a lot of the work that she's doing and provide some guidance on managing some of those cases that are pretty specific to her role. So that's up and coming. So thank you to all these wonderful editors who have really worked hard on their sections and put some time into also reviewing submissions. If you are wanting to write something, it is a peer-reviewed process. So what you would do is if you're looking to publish or do any work through the Moran Corps, first and foremost, if you have like an interesting case or something that you think would be relevant, look at the website and just find the section that it would be in. I know students often see Stargardt's for the first time and they're like so overwhelmed that they just are dying to write about it. And then they see that there's a lot of articles on Stargardt's, which is still great to add to that body of material. But if you look at the website, you'll see there's a lot of sections that are not populated with a hyperlink yet. And those are the ones that we're really trying to fill in. So look at sections that are still needing information on the Moran Corps website, and then contact the section editor as your first reviewer, and then I often am a second reviewer so that the publication can be peer reviewed, and then you can put it on your CV. It's one of the lower hanging fruit when it comes to trying to get publishing opportunities. Any questions on that? So another important thing we're going to talk about, which is really relevant to, again, having kind of being in July at the start of a new academic year, is just a review of how to be compliant with HIPAA and safe harbor de-identification and all that we do. There was an incident in 2024 where you may be familiar with this, but there was a family that they were researching the disease that their child passed away from. And because we publish the grand rounds that we give, the grand rounds case in which this child was presented here at the Moran came up, and they watched it, and they were a little stunned to see their child's case presented. And there were photos that were HIPAA compliant, kind of to what we've maybe previously thought, but they could identify as their child. And then they described the presenter said, because this child was in a lot of discomfort, that the presenter said this child was a difficult exam, and they interpreted that as like they were calling the presenter was calling their child difficult, which obviously was not the case, but it felt really personal since their child had passed from this disease. And then they kind of came after the university and understandably upset. And thankfully, as they looked into it, there was actually all the HIPAA had been removed as much as they could, but it was this puzzle game where they could put pieces together and identify it was their child, and went through kind of a big process with the university. And the response is that we did some training, and this actually is part of the response as well, is to do some training at a grand rounds of how we can be more HIPAA compliant. So the something that we often forget is that if you're presenting a patient, and let's say you're doing a grand rounds of just one patient, contacting that patient and getting their authorization is number 1, 2, and 3 is the best practice. It's difficult. It's often difficult in clinic. We looked at could we just get a consent form that patients fill out routinely as they come into clinic so that everyone's kind of consent for this? And I was told by our front desk staff that to get them to just sign to be billed is like often this laborious conversation. And so if you throw this HIPAA form at them, it's going to just kill kind of the process of checking patients in. So you as a presenter ought to consider contacting the patient, especially as one patient, and getting this form filled out. There is here is the form. If you can look at it, it doesn't really populate very well on a phone, but you can kind of bring it up on to the Pulse website. The form itself is pretty extensive, and you want to probably pre-fill it out so that you can, if it's too small here, but they consent. You check which boxes they're consenting for, whether it's for like an online presentation, a broadcast by radio, so you post on the internet, and so
Griffin,
yes,
if you publish a case in the literature, publishers are asking for this form or something like it, that you have contacted the patient and gotten their permission to publish their case.
that's great, Kathleen. Yeah, so for publishing on Moran Core, for presenting grand rounds, and then for just publishing generally, it's probably all important and applicable. And what's nice is if you get this signed, most of what I'm going to say doesn't apply. I mean, you still want to be careful and you kind of talk to them and protect their identity, but it just changes. A lot of patients actually feel when you really present it in the sense that you're trying to help other people who may be suffering from similar conditions. This really actually is, and many times something that they're excited to participate in and contributing to the general body of literature. So it's an extra couple of steps, but if you're just doing like a single case presentation, it's actually not that onerous. So let's say you don't get this form signed, or it's for reasons it's challenging. So the next process is to go through the de-identification. And Safe Harbor is the kind of the name of the de-identification method we use. You have to use this kind of in almost any time in which you are communicating or sharing or teaching with patient information. And so these unique identifiers are what needs to be removed. And I already went over this at orientation, but again, this just for covering it one more time. Again, and part of our agreement with the outcome of the incident was to do this training for the entire department. So a lot of these are obvious names, account numbers, email addresses, home address. Most of these I think we knew. Something that is really interesting is location. You are not allowed to actually reference where they're from any smaller than a state. So I can't say somebody from St. George presented or from Salt Lake or whenever you're referring, you can talk about where they receive treatment, but you have to say they have somebody from the state of Utah or the state of Nevada. Number one. Number two, you also can't talk about their age. You reference their age in usually like a decade. So you try to not give their exact age, but kind of somebody in their 50s to protect them there. And then what's interesting is you also have to be really careful about age when they're over the age of 89, because it's such a smaller subgroup of people that it's more identifiable. I mean, it gets pretty strict. Let me pause there. Any questions on that? What happens and what kind of happened with our case is, let me pause with one thing here. So images where somebody has specific tattoos and you're showing those, or a hair or nails, something about them that would be even unique that you feel like is not typically need to be blocked out. If it's a really specific image to that patient, you've got to be more careful. The puzzle piece method is a good kind of point here. This is kind of what happened in our case. No specific HIPAA violation was performed, but there were all these features about the disease, the age of the child, where they were from, pictures that showed enough to be recognizable, and that the family could put it together. A case should be so de-identified that if the individual themselves watched it, they wouldn't be sure if it was them or not. They actually wouldn't be able to identify that. I think that's pretty challenging, but you also have the option, if you're ever presenting at grand rounds and you feel sensitive that this might cross some of those lines, just ask Ethan to not publish it. So we don't have to put everything on our Moran Corps website if we feel like it is sensitive or too close. Like we don't put our M&Ms on, we don't record those, and there's a handful of things we don't record. And you can control that just by talking ahead of time. Judith.
Especially technology to run it through a AI thing that would kind of turn it into a cartoon.
It's a very interesting question, Judith. I don't know. Ethan, do you know anything about that?
Something like that out there. I myself haven't had any experience doing that.
And Judith, explain to me your thinking with.
Well, if, say for instance, you were trying to show an eye movement abnormality or an eyelid abnormality, but you wanted it to be real, not just like an animation that you made up. So if there would be a way to, through AI, I'm assuming, to run a video through, and it would sort of identify the key features, the eyelids and the eyes, and be able to recreate that, but in a cartoon animation format rather than a live, actual real person video. And so you would be demonstrating actual eye movement, for instance, eye movement abnormality, without it being a picture of that person at all.
Yeah, that's really interesting. I think we're probably at the point where that's technology's there, but if we have at the university level, I'm not sure. What's also probably, I'm sure there is that you could even just write what the eye abnormality is, and AI would probably create it even if you didn't have it filmed. I mean, I think we're to that level, but that's not a bad idea. And I think with, when we're showing those face shots too, those are, you almost can't get away from a face shot, or at least, a pretty good eye shot. If you're going to publish something on an eye movement abnormality, if you get the consent, then it's totally fine to show. You don't have to do any of that. But I think, again, we often don't have that consent, but that just makes everything so much easier. Really interesting thought, Judith. Thank you. Any other questions?
All video the faculty on or fellow, and we're sharing like a video of the eye movements. We have to also like crop out the nose.
Yeah, technically that would count as a verbal communication of patient information. So you have to follow all the same HIPAA compliance. So if you're, I'll just say that and let you kind of figure that out, how it works. I know that's challenging.
That Moran has a really good point. Why can't we actually do that for all images and run that through all AI and change everything so that it becomes an AI generated image and then it's completely HIPAA compliant because it's all AI. You can't ever say that it's anything.
Yeah, I think that we'll hit the drawing boards on what that would look like to get that with the library committee. Okay, interesting. See if you could just kind of keep the pathology, but then recreate either cartoon form or just an AI face that still demonstrates it without exposing any identifying features. So.
Regard to sharing photographs and videos is to send it to email, and then it's PHI, and then it's at least sort of often publicly searchable.
Yeah, by putting PHI in the subject, it then becomes encrypted, and then it's within the university and protected with an added layer. So, yeah. Great point. Or we can put it into the chart too. We can store it in that chart. These pictures, but
Right in the chart.
yeah,
It's not as easily accessible by your faculty or fellows if you're trying to communicate, but that's definitely a way to do it.
Yeah.
And then it's documented in the chart.
Genius. Any other questions? We appreciate you. I know this is a little intimidating just when you're putting together a presentation. But I think again, this was a fairly traumatic event for this poor family, and they probably could have pursued some painful legal actions, and they didn't, largely because we agreed to really try to be careful and make sure to educate our department about how to avoid this happening in the future. Just with photos, zooming in, if you could zoom in and as is shown here, then you can really avoid some HIPAA issues. And that's it for me. Thanks, everybody. Let's see. Do you know Ethan? Is David on?
Crandall?
David Crandall, yes. No, okay.
Dave Meyer is, but.
David Meyer is wonderful. Yeah. I should have thrown the last name. Yeah. Is there a David on? No, that's not helpful. So David Crandall, do you want to give us an update, Kathleen, or? So David Crandall actually is Alan Crandall's son, a practicing ophthalmologist. We received, I believe it was a stack of CDs and DVDs about yay high of Alan Crandall's teaching, videos, surgical videos, things that he shared, both from domestic and international work. And they donated it to the library, and which was great. But the question is, what do you do with a stack this high of that information? And so his son, David, is actually going to go through it and create a Crandall section, including greatest hits, the videos that he kind of shared most frequently at many of his conferences, which I mean, I wasn't around to attend any of these, but there were these great ASCRS and surgical conferences that I've heard of where people would discuss a certain surgical issue and they'd say, this is impossible to correct surgically. And then he'd be the next presenter and show a video of how he did it. So his just reputation and legacy are pretty phenomenal. And so we'd love to capture a lot of these videos, many of which were both innovative and kind of game-changing in the field of ophthalmic surgery. We're going to create a section around core that's going to include these videos and try to be sifted through so that it's got the most high-yield videos accessible first. But his son has graciously agreed to go through that stack of CDs. It's a 2 or 3 year project he's engaged in that will then be published on the Moran Core. We invited him to come. He's actually practicing in Michigan and was unable to join us this morning virtually, but we just wanted to say thank you to him, and we're super excited for that project to come out. That'll be really interesting. I'm going to turn it over to Bryan Hull from the Eccles Library. I was going to say, sorry, Bryan, before I jump into you, one more thing. Also, for those who are publishing, Maddie or Sam Wilkinson are here, 2 of our friends, but I'm writing a couple of papers right now with a couple of our residents, and the fees with publishing are just astronomical these days. But another great thing that the library committee can do is, and specifically, we've worked with Christy Jarvis, is that you can email her and say, what journals do we have a relationship with where the library has already paid a certain amount of money to cover those publishing fees? And she'll tell you all the journals that you should submit to, for which you won't even have, that cost will be covered for you. And she can actually tell you, and then she'd also give you a list of which, we've sent her our papers, and she'll say, these are the journals that that we feel like this is the best targeted towards. Because one of them was in wellness and resident education, and I wasn't sure which that would go. And she had, in a 24 hours, she generated this great list. And then she said, by the way, these first 3 will pay for the publishing fee. So it's such a resource that I think so many things that we're used to doing, especially as trainees, of spend hours and hours on this search and generating this huge list. They'll just do for you. So please use that resource. They're wonderful. So transition to our wonderful Eccles Health Sciences Library. We're going to have Bryan Hull kind of present a few things to us, and thank you again for the work on behalf of the library.
Good morning, everyone. So I'm Bryan Hull. I'm the project director of the Moran Core. So I work with all the section editors and all the authors to get everything posted and up on the website. In addition to working with Ethan, who handles all of the video stuff and gets all of that edited and up onto YouTube, which is fantastic. If you have any core specific questions, you can absolutely reach out to me anytime, in addition to any of the section editors or Griffin, of course. So just always know if you're wondering about something, always feel free to ask. That's what we're here to do. So I'm going to talk about some of the statistics of the Moran Core just to kind of demonstrate the utility of the resource. This is the statistics for the website. So you'll see that from the very beginning of the project in 2015 to now, the trajectory has been consistently growing. There's a little bit of a dip in 2022 because Google Analytics, which is what we use to track all of the usage, changed the way that they measure things. So there's a bit of a dip, but you can see that the trajectory has continued to climb. And of course, we're only halfway through 2025, so that's why there's a dip there, but there's still 6 months of wonderful Moran Core usage ahead of us. So I'm sure that line will just keep going up, which looks great. One of the most interesting pieces is that 212 countries so far this year have utilized the Moran Core. And if you look at the splits, typically about half of the traffic on the website is from the United States, and then the other half is completely international. So that's a really useful resource for not just, folks in the United States, but across the world as well. And here's a map that says that. The top 10 countries, a lot of Anglosphere, of course, but India, Philippines, Malaysia, Indonesia, Brazil, and Thailand are also heavy users of the Moran Core. So if you publish something in the core or have presented something that's up on the core, know that it is being utilized across the world. So that's a nice thing to pat yourself on the back with. As you're hopefully aware, the video content for the Moran Core is posted on YouTube, which has many pros and some cons. Some of the cons are exactly what Griffin was talking about, where it is all publicly accessible across the world. So you do have to be careful about what is being presented there. But again, to reiterate what Griffin said, if you're not comfortable with something being presented, it doesn't have to be public. If you are presenting something public, make sure you follow all of those wonderful privacy guidelines and we'll be all set. The pros, of course, of using YouTube is that all of that content is completely open to the world. So you generate a lot of traffic to the content that is being created here at the Moran Eye Center, but you're also opening up the audience that can view this stuff. Now, you will see that there is a bit of a downslope on the usage, which doesn't look great because we always just want to see the line go up, kind of like the stock market. The line only ever goes up, it never goes down. But something that's kind of interesting here is we've seen this across most of our products or projects rather that we use YouTube for, where for some reason during the COVID era, there was a huge spike in interest. This is me speculating, at least, but there seemed to be a lot of interest in medical videos. So I think there was a lot of consumption of video content. And as such, the algorithms on YouTube were just kind of feeding people a lot of medical videos. That's kind of cooled off now that we've passed that and we are, in the post-COVID realm where maybe folks aren't quite as interested in medicine for whatever reason. But regardless, the number of views are in the millions, regardless of the downturn, and the watch time is still a significant amount. One thing that I think is interesting too is that kind of during that peak, the watch time kind of spiked, but then it kind of cooled off, but we were kind of coming back. So I'm hoping that that's indicative that the people who are actually watching the videos are people who are like interested in watching that content and are actually like sitting with it and watching it, as opposed to just like watching, 3 minutes and being like, man, this is boring, move on. So last thing, there are 46,000 subscribers to the Moran Core, this isn't really something that we're like pushing. It's just kind of an organic thing. So that's another benefit with YouTube is if you get people to start subscribing to your channel, you kind of have a built-in audience already for your content. So that helps with the number of views, looks good, and yeah, it's really helpful. So one last little bit of fun information. The Moran Core is the second most subscribed YouTube channel on the University of Utah campus. So it has more subscribers than the University of Utah's main YouTube channel, the Athletics YouTube channel. And it is only second to the Eccles Library, which is number one with 200,000. So that's okay though, because this is also connected to the Eccles Library, so it's all good. But anyways, that's kind of just a brief overview of all the statistics. So you can just see that the content is continuing to be utilized across the world and people are tuning in and watching. And Ethan, I don't know if you wanted to say anything, but as a lot of the content on the Moran Core is video content, Ethan is your fantastic videographer who can record stuff for you, get everything all set, and yeah, has lots of options for you and is a great resource to reach out to. So anything else, Ethan?
I need to update that photo at least because I have hair there.
That's okay. I had a lot more hair in my photo, so we're all getting haircuts. But otherwise, I will turn it back over to Kathleen.
I mean, isn't it cool to be at Moran? We've got the coolest place. So we did want to mention some other online resources for you. And this first one that I'm highlighting is the Dizzy School. Now, most of you are not going to deal with dizziness because that's not your shtick. But in neuro-ophthalmology, we see a lot of dizzy people. And Judith has really spearheaded this in partnership with Intermountain Healthcare. And so this is a website we've put together with all kinds of resources for patients, as well as providers, because people don't really know what to do with this. And we highlight 3PD. If you don't know what 3PD is, it's persistent postural perceptual dizziness. It's people feel dizzy and there's nothing wrong with them, but they still feel dizzy. So we know about this stuff. Anyway, it's a great resource to know about. The one resource that you might want to know about also is Headache School. Headache School has been in existence for now, I think, 15 years. And it has short videos on headache topics. And so many of you see people with dry eyes and they have bad pain and et cetera, eye pain, et cetera. You can send them to the Headache School if they have headaches and actually learn about different aspects of headache. So and all of this is free and open to the world. You just click on it and go for it. And then I would be remiss if I didn't mention the Neuro-Ophthalmology Virtual Educational Library. So this is an online resource of over 20,000 items. There's 31 collections from all of the neuro-ophthalmic gurus of the world. And a lot of it's on YouTube. It's a library. There's a historical portion. The Walsh and Hoyt textbook is on this. We've also got the copyright to Irene Lowenfeld's The Pupil, the Bible of the Pupil. It's this thick. The book is this thick. The references are this thick in a separate book, but we have access to all of that. And it's hosted on the Eccles Library. Novel is a partnership with the North American Neuro-Ophthalmology Society and Eccles Health Sciences Library. Again, the coolest library in the world. So with that, all of us can take any questions that you have, but these are resources that are open access and might be helpful for your patients.
Thank you.
Okay.
I just want to congratulate the Moran Core. It's both in my mind are really our greatest resource that we have, inward facing and outward facing. And simultaneously, I feel like it's also, our most untapped potential resource that we serve with, more potential to do more. I'm not, of course, entirely surprised by the drop off in users. I mean, that would be expected after COVID and so much content online. And yet, it feels, and I could be wrong, correct me where I'm wrong, that in terms of kind of regeneration of content, also peaked. And I wonder if, in your estimation, part of this downward trend has to do with less material being produced. What other contributors there might be in a world where you had additional resources? How would you take this to a new level?
Do you have ideas?
Sure, good to hear. Yeah. So I do think like my online fame, Jeff, has been from my daily posts. Just kidding. So I think anyone who is successful online, it is about consistent new content. And I think that would be the surgical videos get probably the most interest, but they're a lot of work, and Ethan makes that work significantly less. But I do think if we just had just a steady stream of just new surgical content, we kind of put a lot of this on all at once. And we like flipped the switch on the YouTube channel several years ago because we were trying to decide how public to share this. And when we shared it, when we opened up the YouTube channel to make it searchable within YouTube, not just having to go through the main core website, that's when you saw this like exponential increase. But then I think that content kind of got consumed. But there's all those subscribers, every time we post something new, it hits their channel. And then new content also in the algorithms of YouTube has kind of, comes up faster and sooner. So I do think having support to faculty when doing anything interesting surgically to streamline the process of recording, publishing, and sharing, and it has tremendous value to keep that up. I also think that there is a ceiling of interest in ophthalmic work around the world. There's not that many ophthalmologists, so we could do all of that and still have just the same audience. But I do think that's probably the next step, is to just try to become more regular and frequent with the content. We released a lot at first, and that's been slowed down.
And I want to echo that. I think new content is really helpful, and you can create your own. For example, with the MOL education series, and you want residents, fellows to hear a certain lecture, but you don't want to give that lecture. You just want them to view it maybe in 4 times the speed, so you sound like a chipmunk. But you can do that. Ethan can set you up. You can just get a little lecture. If you have a special lecture that isn't in the core and you want to put it in there, you can. If you have a topic that you just suddenly came upon, something new that you'd like to just get out to the world, you can do that as well. So it is content, and you can generate it, and it doesn't have to be like part of Grand Rounds. It could be just a standalone educational thing that can be put into whatever section editor wants to put that in.
Yeah, in fact, some of the most popular videos are actually like Judith Warner teaching the neuro-ophthalmic exam. It's a short video of her explaining how to do the exam, but it's not just surgical videos. And the lectures too, when we switched to a flipped classroom, it's been harder to record because it's so interactive. So if you want to still have that content posted, I think that's really beneficial material out there. You can maybe try to choreograph the session to have the first section be recordable and publishable, and then when you're interacting, doing more hands-on things, then maybe just post that first part and work with Ethan on that. We've had some inquiries about that.
Yeah, but I mean, there's certainly nothing to be ashamed of. There's only 18,500 practicing ophthalmologists in the US, and 46,000 subscribers is extraordinary. And of course, you'll reach a steady state. But again, in terms of keeping it this living, breathing resource, I really like your ideas, and again, it's something that collectively I just want to voice my support, is that top priority for what we do.
But the great thing about the Moran Core is that with Ethan and other recording devices, we haven't changed anything we've done. We've just found ways to capture it and share it. And I think we're really so lucky to be here, and there's credit to everybody.
And then when you go internationally, share this resource to them. It's open access. We did for a few places that really don't have any internet, good, strong internet, we've been able to kind of condense a few things into, even a hard drive for, basic educational content. So there's a lot that we can do. And if you have ideas, join the library committee. It only meets every other month. It's the most fun committee you could be on. Right?
Undoubtedly.
Griffin, one question. I brought this up at a library committee meeting. I think I got shunned pretty quickly, but.
We'll bring it up again, Brian. Yeah.
I just wonder with that many subscribers and YouTube hits, we could be monetizing this. And I actually don't think it would be disruptive. That's the argument. But essentially letting ads happen before, in the middle, and after videos, YouTube would start to pay us for the content. No.
The only thing, we do have some problems, right? We've been looked into monetizing things. Oh. No, but we have university rules that we also have to follow. Remember, we're still part of the University of Utah, and we've looked into monetizing. It's such a great idea, and things can change, and we're in a new world of many ways, and things could change. So don't lose that thought. We can keep that thought on the table.
And we as a committee want to publicly apologize to Brian Zog for shunning his idea the last time it was presented. No, I'm just kidding. Well, I think we ought to look into it. Maybe we'll have that be a conversation piece at our next committee meeting.
Yeah.
I think it's worth revisiting because it is. I mean, people. YouTube's making money off of us, and it's worth considering.
We could do it on the YouTube channel.
Yeah, because it's not costing the users anything.
Yeah.
And it's not limiting the content either.
No.
So any other questions or thoughts? If we don't have any, I did want to just introduce Matt Weed, the newest members of our department. Matt, we both here for just a sec because people who are online won't be able to see your face. But Matt comes from Spokane, practicing there for 10 years as a pediatric ophthalmologist. We have hired him, and he's primarily going to be working in our Lehigh location, but I'm going to do all that we can to make him just as a core member of the department as anyone. So, Matt, just give us a quick introduction if that's okay. We're thrilled to have you here.
Yep. I grew up in Holiday, Utah. I went to Olympus High and then BYU and then UCSD for med school. And then Iowa for ophthalmology residency and an inherited retinal disease fellowship and a pediatric ophthalmology and strabismus fellowship. I've been in private practice in Spokane for the past almost 10 years, 9 years. And my wife and our kids and I all moved down here. We're very excited to be here. I'm excited to be back in my home state. I, like Griffin said, will be mainly at the new Lehigh location of Primary Children's doing pediatric ophthalmology and adult strabismus. I will also have a once a month, as of now, inherited retinal disease clinic for pediatric patients here in Salt Lake. I'm excited to work with you and the opportunities that I have. Please let me know if there's anything I can do to help you or if you have any questions. I'm excited to be here.
Yeah.